In this video, we will discuss regarding part 2 of Sri Chitra question paper, that is 2015 question paper. First question is, when a hemophilic carrier female marries a normal male, the chance of their daughter becoming a carrier is options 100%, 75%, 50%, 25%. The correct answer is 50%. When a hemophilic carrier female marries a normal male, the chance of their daughter becoming a carrier is 50%. A nurse observes oblique spot on oral examination of a child with fever. This is indicative of options are measles, diphtheria, dengue fever, whooping cough. Oblique spot is seen in measles. Next question. Census is taken once in every options 5 years, 10 years, 15 years, 20 years. Census is taken once in every. Correct answer is 10 year. Next question. The nurse is teaching a client about iron-rich food to be consumed to correct anemia. Which one of the following vitamin has to be supplemented to increase iron absorption? To increase iron absorption, have to consume vitamin C. Next question. In which of the following leadership style the leader value the individual characteristics and abilities of each subordinate? The options are autocratic, democratic, laissez-faire, bureaucratic. The correct answer is option B, democratic. In democratic leadership style, the leader values the individual characteristics and abilities of each subordinate. Next question. Which of the following is known as pacemaker of the heart? Options are SA node, AV node, bundle of His and Purkinje fibers. Correct answer is option A. SA node is known as the pacemaker of the heart. Next question. The left atrium and the lateral and posterior surfaces of the left ventricle is supplied by which artery? Options are left anterior descending coronary artery, the left coronary artery, the right coronary artery, the circumflex artery. The correct answer is option D, the circumflex artery. Next question. Which one of the following is a potassium sparing diuretics? Options are spironolactone, mannitol, furosemide, chlorothiazide. The correct answer is option A, spironolactone. Next question. Digoxin is withheld if the pulse rate is less than. The options are 40, 50, 60, 70. The correct answer is option C, 60. Next question. A nurse who observes absence of P waves and fibrillating waves before each QRX complex on the cardiac monitor will interpret the client's cardiac rhythm as. Options are sinus tachycardia, ventricular tachycardia, ventricular fibrillation, atrial fibrillation. The correct answer is option D, atrial fibrillation. Next question. The most important risk of deep vein thrombosis is. Options are myocardial infarction, pulmonary embolism, phlebitis, bleeding. The correct answer is option B, pulmonary embolism. Next question. Which one of the following interventions should be avoided by the nurse while caring a client with a deep vein thrombosis? Options are providing bed rest, elevation of affected extremity, massaging the extremity, administering analgesics. The correct answer is option C, massaging the extremity. Next question. The normal volume of CSF is. Options are 25 to 50 ml, 50 to 100 ml, 125 to 150 ml, 150 to 200 ml. The correct answer is 125 to 150 ml. Option C. Next question. Which of the following neurotransmitter is deficient in myasthenia gravis? Options are acetylcholine, dopamine, serotonin, norepinephrine. The correct answer is option A, acetylcholine. Next question. In paraplegia, paralysis involves. Options are all four extremities, only lower extremity, one side of the body, only upper extremity. The correct answer is in paraplegia, paralysis involves all four extremities. Next question. In the assessment of a client with Guillain-Barré syndrome, the nurse gives high priority to. Options are pain, level of consciousness, motor functions, respiratory status. The correct answer is option D, respiratory status. Next question. Which one of the following is an anticonvulsant drug? The options are bromocriptine, lergactil, phenytoin, chlordiazepoxide. The correct answer is option C, phenytoin. Next question. Perception in the absence of external stimuli is termed as. The options are delusion, illusion, phobia, hallucination. The correct answer is option D, hallucination. Next question. 1 tablespoon is equal to dash ml. The options are 5, 10, 15, 30. The correct answer is 1 tablespoon is equal to option C, 15 ml. Next question. The physician prescribed 1500 ml ringer lactate to be infused in 12 hours. 1 ml equal to 15 drops. The drop rate should be. Options are 20 drops per minute, 25 drops per minute, 31 drops per minute, 35 drops per minute. The correct answer is option C, 31 drops per minute. Next question. The physician prescribed phenytoin 0.2 gram orally twice daily. The medicine is available as 100 mg capsule. How many capsules will be administered for a dose? Options are 1 capsule, 2 capsule, 3 capsule, 4 capsule. The correct answer is option B, 2 capsule. Next question. During CPR of an adult client, while performing the chest compression, the sternum will be depressed to. Options are option A, half to 3 by 4th inch, 3 by 4 to 1 inch, 1 and half to 2 inch, 2 to 2 and half inches. The correct answer is option C, 1 and half to 2 inches. Next question. In which one of the following situation the rescuer uses jaw thrust method to open the airway? The options are in all situations requiring CPR, if the client has a history of epilepsy, if the client has a history of head injury, if injury of the neck is suspected. The correct answer is option D, if injury of the neck is suspected. Next question. Which of the following assessment data is relevant for a client diagnosed with glaucoma? Options are history of diabetes mellitus, history of migraine, history of chronic sinusitis, history of bronchial asthma. The correct answer is option A, history of diabetes mellitus. Next question. A nurse monitoring the intercostal drainage system of a patient with pneumothorax notes intermittent bubbling in the water seal chamber. The most appropriate action would be. Options are inform the physician, check for air leakage, document the observation, clamp the chest drainage tube. The correct answer is option C. Document the observation. Next question. The arterial blood gas report of a client shows pH of 7.32, PCO2 52, PO2 85, HCO3 of 27. The nurse interprets that the client has options: respiratory acidosis, metabolic acidosis, respiratory alkalosis, metabolic alkalosis. The correct answer is option A, respiratory acidosis. Next question. While monitoring a child after tonsillectomy, the nurse observes him swallowing frequently. This indicates that the child is, options are, feeling thirsty, recovering from anesthesia, bleeding, having pain. The correct answer is option C, bleeding. Next question. The nurse is reviewing the laboratory values of a patient scheduled for surgery. Which one of the following result is unfavorable? Options are FBS 84, HB8, serum creatine 0.7, blood urea 28. Correct answer is option B, HB 8 gram. Next question. Which one of the following statement is incorrect about Glasgow Coma Scale? The given options are: the scale measures the neurological status, the sensory responses are easily assessed, the maximum score is 15, a score less than 8 indicates coma. The incorrect option is option B, the sensory responses are easily assessed. Next question. The site selected by a nurse to administer an intramuscular injection to a 6-month infant is options: vastus lateralis, ventrogluteal, dorsogluteal, deltoid. The correct answer is option A, vastus lateralis. Next question. Which of the following age group children engage in parallel play? The options are infant, toddler, preschooler, schooler. The correct answer is option B, toddler. Next question. In which one of the following conditions turning sign is considered as a positive indicator? Options are meningitis, hepatitis, deep vein thrombosis, thyroid. The correct answer is option A, meningitis. Next question. Which one of the following is the most potent stimulus for erythropoietin production? Options are anemia, proteinuria, hypoglycemia, hypoxia. Correct answer is option A, anemia. Next question. One of the major complications that occur during hemodialysis is, options are muscle cramps, hypotension, air embolism, pulmonary edema. The options are, correct answer is option B, hypotension. Next question. The letdown reflex during breastfeeding is influenced by the hormone. The letdown reflex during breastfeeding is influenced by the hormone. Options are progesterone, estrogen, prolactin, oxytocin. Correct answer is option D, oxytocin. So, 2015 question paper part 1 and part 2 already discussed. In next video, another one important question paper we will discuss. Please share and subscribe the channel for more videos regarding the question papers. Thank you.